Gourmand Syndrome. Now, what is that? Hi everyone, I'm Dr. Katrina Mattingly, Chief Medical Officer at Options Medical Weight Loss. Now let's switch gears a little bit. We always talk about our medications and different ways to lose weight. Let's talk about some really interesting eating and weight-related syndromes that are not quite related to just medication all the time. So if you've never heard of Gourmand Syndrome, it's been diagnosed in a small subset of patients over the past 30 years. Now, usually this is someone who develops a taste for fine dining and fine dining experiences. Usually these patients have a history of some type of traumatic brain injury that's happened on the right side of the brain, or in the frontal area or the temporal area. Now, this can be a concussion, something traumatic, seizures on the right side of the brain, or even maybe not getting enough oxygen to the brain, right side. Now, the brain pathways help to regulate our appetite and our metabolism. So there is a disruption that occurs, and now these people are obsessed with fine foods. So what are some symptoms for someone that's been diagnosed with Gourmand syndrome? So this is someone that doesn't have a previous history of any type of eating disorder or any type of obsession with any particular food. But now they have a change in their culinary taste. Now some of them may have a dislike for things that they really liked before, or really common foods like hamburgers or French fries, for instance. So now they are impulsive. They're constantly seeking out these dining experiences or particular foods, whether it's 3 a.m. in the morning or it's 3 p.m. in the afternoon. They want sushi right now. So they're gonna get up and they're gonna go and they're gonna get on these apps and order sushi at 3 a.m. or 3 p.m. Now, as a result though, some of these patients get a little bit malnourished. If you're just eating sushi all day and you're just concerned about getting the best cut of the freshest fish, then you're not getting all your fruits and vegetables. Conversely, we have some people that may gain weight because maybe they're sitting around and they're eating the freshest pasta all day. Another thing that happens is this can become a financial burden. If you're flying to Japan to get the freshest cut of fish, or you're flying to Italy to get the best pasta, then you may start to have some effects on your pocketbook, and that can kind of affect your relationships with family, your relationships at work. So you can kind of see how this obsession with fine food or this impulsivity and this addiction can lead to further problems. Now, there are some treatments for Gourmand syndrome. The number one thing being therapy. Cognitive behavioral therapy or immersion therapy are two things that have been studied for these particular patients. We can also do obesity medicine treatment and medications for some of these patients, although it's not likely to be as effective without the therapy that kind of helps them to get this behavior under control in the first place. And then some patients are finding that they have some success with taking medicines for their OCD or the addictive potential. So some really interesting facts about Gourmand syndrome are that a lot of these people actually became really, really well-known food critics. There was somebody who was a marathoner that all of a sudden had a brain injury and then developed Gourmand syndrome, and they actually went from being the weight of a marathoner to gaining 100 pounds and then becoming overweight. So there's a lot of really interesting experience and complications and then health effects that come from having this particular syndrome. So if you are on Jeopardy, and the final Jeopardy question is, this patient travels the world in search of the finest fine dining experiences and spends tens of thousands per year doing so. What is the syndrome? And your answer is going to be, Alex, what is Gourmand syndrome? Now, at Options, maybe we can't cure Gourmand syndrome, but we can definitely help if you're overweight or if you're having some struggles with food, feeling like you're addicted to sugar or addicted to carbs or having some binge eating or night eating. All right, we're really good at helping to come up with a plan to help you get those things under control and get you on your way to a healthier weight and a healthier life. Click the link below if you're interested in learning about any of our programs, because at Options, we have options for everybody.
Did you like this video? Like, subscribe, and ring that notification bell so you can stay up to date on our latest videos. You can also visit our website using the link below to schedule a free consultation with us. We have options for everybody.